Good morning, everyone. So before we start my speech, I have a joke for y'all. So how did the skeleton get the girl?
How?
Because he was humorous. It's so funny. So if you hadn't guessed, today we're gonna be discussing bones, and to be more specific, broken bones. So today my mother is in the video. She is my patient, and we're gonna talk about how to put on a cast. So I learned how to put on a cast from the Bone and Joint Clinic. That's where I work, and all of our doctors there are board certified through the American Board of Orthopedic Surgeons. So that's where they got their certifications from. So, um, that's we're gonna start putting on the cast. So before we start putting on the cast, we usually go over the patient. We do an X-ray, show them where the broken bone is, and then discuss treatment plans. So if you have a broken bone, you either can get a cast put on, or you would have to have surgery. And if you require surgery, if you have a distal radius fracture, they would put a plate in your arm like this with these little tiny screws, and that would hold the bone in place. But if it's not that severe, you would just get the cast put on, and that's what we're going to do today in the video. So next, after we explain to the patient that they're getting cast, we move them to a different room, and that's where we apply the cast. So before we start, we put on gloves. Then we ask the patient what color cast they want. So we have a lot to choose from. We have red, blue, green, black, pink, kind of any color you want. But for the purpose of this video, we're going to use red. So before we start, we tell the patient to put a towel over them so that the cast does not destroy their clothes or get any kind of stains. And then we start to wrap the patient's arm. So before you start, you put the little sock on the patient's arm like this. I can get it open. And so today we're doing a short arm cast because her broken bone is going to be right here, like we talked about her distal radius. So you put the stocking on her arm like this. Then you cut right here for her finger to come out. You leave it like this over the fingers a little bit. Then you wrap it with cast padding. And you want to do the cast padding kind of tight, but not the actual cast. So you wrap her arm completely. And you do leave the sock a little bit exposed over the fingers because you're going to wrap it over the cast later. So when you do in between the fingers, you kind of twist it and roll it like this. So after you have all the cast padding on, you're going to start with the cast material. So you open the pack up, and then you take it, and it has to be activated with water. So you put it in the water, and you squeeze out all the excess water, and then you're ready to apply the cast. So it doesn't matter where you start. You can start from the back or the front, either way. And you just wrap it over the cast padding. Then like we left the little stocking over it earlier, this is where we fold it down over the cast. And get the patient to kind of put her hand up like this. And you keep wrapping and wrapping. And then after it's all done, you can just cut off the excess part. Get some extra water on your hands and then smooth it all together like this. And make sure it's nice and tight on the patient so that their bone's not going to shift and move once it gets hard. And then there you have it. Her cast is on. So then normally you have to wait between 5 to 10 minutes until it gets hard. The patient will start feeling it get hot, and then after that it'll get hard and solid, and then she'll stay in that for 4 weeks. So do's and don'ts when wearing a cast is you can't get the cast wet. So when you take a shower, you have to put a cover over it, so some type of bag, and tape it secure so there's no water that gets into it. No swimming unless you have it protected. And if you end up no swimming. And if you get caught in the rain, you have to blow dry your cast on like a low setting or a cold setting, because if you do the hot, then it'll burn you. And do's and don'ts, so after you do that, if your hand starts swelling or your fingers start swelling or get discolored, you'd want to call a doctor because it could be too tight. Or if you have any numbness in the fingers, you'd want to call a doctor as well. Or your elbow starts getting sore or anything like that, you want to call a doctor because all of it you shouldn't have any pain in the elbow or any swelling. So any questions from you, ma'am?
Nope.
Okay, so thanks for watching. That's my video on how to put on a cast. Thank you.